Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Fluticasone. Its brand name is Veramyst or Avamys. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Fluticasone is a corticosteroid whose anti-inflammatory properties aid in the symptoms or treatment of asthma and allergic rhinitis. In terms of indications for use, we did kind of just mention them there, but Fluticasone is indicated to be used in the treatment of asthma and allergic rhinitis. Now, before somebody was to use Fluticasone, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to Fluticasone or any other component of the product, they would not be able to use this medication. This medication also cannot be used to treat status asthmaticus. Now in terms of precautions, it's not recommended to use potent CYP3A4 inhibitors while using Fluticasone. Allergic conditions may be unmasked when transferring from systemic corticosteroids to inhaled corticosteroids. Paradoxical bronchospasm may occur with the use of Fluticasone, and the medication should be discontinued if this was to occur. Patients with recent nasal ulcers or nasal surgery should not use Fluticasone as it may cause impaired wound healing. Yeast infections of the nose, throat, and pharynx are possibilities with the use of this medication, and the medication may have to temporarily be stopped if this was to occur. Once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Fluticasone, they may receive their dose through oral inhalation or through a nasal spray. So if somebody is using this medication to treat asthma, they would typically use 100 micrograms inhaled once daily. If there's a poor response after 2 weeks of using 100 micrograms daily, they can sometimes increase the dose to 200 micrograms daily, and that would be the max dose. It's also important to note not to use this medication more than once daily. If somebody is using Fluticasone to treat allergic rhinitis, they would typically use 2 sprays in each nostril once daily. After maximum benefit is achieved and symptoms are under control, they can decrease the dose to 1 spray in each nostril once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Fluticasone, so I'll go over some of those here now. 6 to 13% of patients may experience a headache. Cough may occur in 3 to 4% of patients. And up to 20% may experience an acute hemorrhage of the nostril. 2 to 4% of patients may experience a pain in their throat. Now, some more rare but serious side effects would be bronchospasm, a nasal infection, a yeast infection, or pneumonia. That's all we're going to talk about today with Fluticasone or Veramyst. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.